In addition to nosocomial infection, tissuing infiltration, embolism, extravasation, and cellulitis, other risks include allergic reactions, including anaphylaxis, Stevens-Johnson syndrome, and nephrotoxicity. The most common causes of anaphylaxis often occur with antibiotics. Also true with Stevens-Johnson syndrome, specifically sulfa drugs. Some of the penicillins like ampicillin, amoxicillin, quinolones, cephalosporins have been known to cause Stevens-Johnson. Phenytoin, carbamazepine, phenobarbital, valproate, and lamotrigine. So several of your anticonvulsant medications have also been known to cause Stevens-Johnson syndrome, as well as other types of drugs such as allopurinol. It's a hypersensitivity reaction that causes a purple lesion to occur. This can also occur as more serious infection, which is called TENS, which actually causes toxic necrosis of the epithelial layers of the skin. Continuing on talking about compounding of antibiotics. Chapter 9 is primarily small volume parenterals, and we will be doing mostly reconstitution of antibiotics. So in compounding them, it's important to understand what the medication actually does. So antibiotics are antimicrobial medications used to treat different types of infections with specific microorganisms. Most often it's going to be bacteria, but some anti-infective agents, antimicrobial antibiotics, may also be effective against certain types of fungus or protozoals. Antibiotics are not effective in treating viruses. The term antibiotic or antibacterial are sometimes used interchangeably. Most of the bacterial microorganisms are either going to be gram-positive or gram-negative, and that has to do with the cell structure. The bacterial cell wall structure, I should say. In essence, gram-positive bacteria tend to have thicker cell walls than a gram-negative bacteria. Patients requiring IV PVAC antibiotic therapy will undergo blood testing. This is known as culture sensitivity testing. Well, this should be corrected. It's not all of them, but some of them will. Usually to determine the appropriate what's the causative agent or the pathogenic organism causing the infection, and whether it is a gram-positive or gram-negative type infection. That way we can identify the best drug to treat that type of bacterial infection. For IV techs, we need to be aware that there is antibiotic-resistant bacteria, and this is becoming more and more of a concern. So it's very important that we use these medications properly and that they're made properly. This type of resistance is often referred to a superbug, and the evolution of these superbugs is influenced by two factors. Widespread use of disinfectants, so antimicrobial soaps and hand sanitizers, which were meant primarily to be used in a hospital setting, are used commonly every day, and also overuse of antibiotics and inappropriate antibiotic use. So the antimicrobial overuse, an antimicrobial is a substance or a chemical compound capable of killing or inhibiting the growth of microorganisms. And like I stated previously, that these are found in many household items such as hand soaps, cleansers, and surface disinfectants, as well as some of the medications. The rise in the use of this help produce these various microbes or superbugs. Often, the prescribers yield to a patient's demand for antibiotic treatment, no matter what the symptom. If it's a viral infection, the doctor will often give in and give them a prescription for something, because the patients kind of think, I paid my copay, I'm here, I'm sick, you need to give me something. And the doctors kind of give in to that. Another source of antibiotic overuse comes from the use of antibiotics in food processing for meat and dairy industries. Their policies allow for prophylactic antibiotic treatment to help promote healthy livestock. So it then gets ingested into a human when that meat is consumed. So it is a risk. It is a concern. The World Health Organization, which is known as WHO, has identified superbugs as a global threat. Due to the widespread use of antimicrobials and antibiotics, superbugs such as methicillin-resistant Staphylococcus aureus, which we refer to as MRSA, carbapenem-resistant Klebsiella pneumoniae, and New Delhi metallo-beta-lactamase are on the rise and considered by many scientists to pose serious threat for global health. So the World Health Organization in 2011 made a plea to reduce the overuse of antimicrobials. Okay, now it's your turn. This is a substance or chemical compound capable of killing or inhibiting the growth of microorganisms. That would be an antimicrobial. These are considered by many scientists to pose a serious threat to global health. That would be the superbugs. Now it's your turn for some questions. Continuing on, USP Chapter 797 guidelines for compounding small volume parenterals are in line with all of the other parenteral administration guidelines or preparation guidelines for large volume parenterals. So it's, again, very important that we follow all the guidelines as they're outlined. So our essential supplies that we will use, again, will be available both in the ante and the clean room. And for our piggybacks, for our vials, most of the IV piggyback compounding procedures require us to reconstitute a powdered antibiotic drug that's within a vial. To do so, we will need to draw up or add a diluent that comes from a separate vial and is injected from the fluid into the vial containing the powder. There are different methods to complete that procedure, including the milking technique. Can also use a vented needle or a repeater pump. Because positive pressure was created within the vial when the diluent is added, the milking technique can be used to withdraw the dissolved powder from the vial without injecting air. I will illustrate that practice. Now, that only is valid if you are withdrawing the entire contents of the medication vial. This method of reconstituting a powder within a vial is best when using a prepared single CSP in which the whole amount is drawn out. So, reconstitution using the milking technique. So, first off, we're going to withdraw the contents. Now, I would like you to pay special note to how this person is holding. This is incorrect. They're holding it from behind. We don't want to do that. When I talked to the author of this textbook and I brought this up, she said, unfortunately, she had staged these photos and then gone to stage another photo, and the photographer asked the model to turn their hand so that they could better see the syringe, not realizing that that could cause challenges with the actual illustration of the proper technique. But what I do want you to note with this being a positive is doing the claw at the top of the vial. And also, there's no obstruction in that vicinity of that needle. No fingers down that area. And that they've had to tilt either the vial or the syringe to get all of the liquid out of that vial. So they're injecting in the air for the milking technique. Now they're letting the fluid come back out through the syringe and fill into the syringe. And that's the milking technique. You push the air up, you let the liquid in. You push the air up, you let the liquid in until you get it all in. Another method used to reconstitute is using a vented needle. Vented needles have a sheath in addition to the regular needle. These also don't have that open spot at the top like a regular needle. It's like a razor. The opening is actually in the shaft of the needle. So this cover actually is down over the front, and as you insert the needle into the vial, it pushes that sheath back so the liquid can come out and reconstitute. You can't use this needle to withdraw the contents. It's not effective. It's only meant to put the fluid in. You don't have to worry about positive, negative pressure because of the vent. It will then let all the air out through the syringe. So you don't have to worry about that milking technique. So, as I was saying, it's unique and allows the injection into the vial while letting the air vent out, and it's only used in reconstitution. Most hospitals will not use these because basically it's throwaway. Good technique using proper milking technique in a regular needle is sufficient, and you don't have to use multiple needles. So we're going to do it with just a regular needle, but you need to be aware of what a vented needle is and how it works. So with a vented needle, you just go straight in because you're not concerned with coring because it has that razor edge, and then all you have to do is push down to let the liquid go in, and then the air will come out through the vent. Additional supplies include the piggyback base solution. We've talked about this previously. Most often you're going to use a 50 milliliter or a 100 milliliter, either normal saline or D5W, to make a piggyback. When inserting the needle into the port, you go straight in. You're not worried about bevel up, bevel down, or angle. You want to make sure it goes straight in so that you don't puncture the side. You want to go straight in, even though I can't draw straight. Before beginning your preparatory procedures in the anteroom clean room, you have to review all of the critical sites of your supplies. After identifying the critical sites, make sure not to touch or contaminate through shadowing or touch or incorrect placement of the items within the hood.